New reaction today to the CDC revealing a sharp spike in autism cases in children ages 4 to 8. The numbers show 1 in 31 8-year-olds were identified with autism spectrum disorder in 2022, up from 1 in 36 in 2020. Health Secretary RFK Jr. claims environmental toxins are responsible for this dramatic rise.
Genes don't cause epidemics. You need an environmental toxin. These are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted. And we have to recognize we are doing this to our children.
Okay. Joining me now, NBC News medical contributor, Dr. Natalie Azar. I wish you could have seen my face as I was listening to that. I was looking at yours. I'm curious your reaction to what you just heard.
Yeah, Alex. So, there's been resounding pushback against his characterization of children with autism, and appropriately so. All I will say is that it's very factually misleading. Autism, like many, many diseases, exists on a spectrum. And so for him to, characterize, all children with autism as not being able to contribute to their lives or to society is just an awful thing and devastating for families, and really just contributes to the stigma surrounding the diagnosis.
Yeah, absolutely. What about these environmental toxins? What kind of toxins is he talking about? And what do experts say about the causes behind this increase in cases? Might it be due to more precise diagnostics?
Right. So I think the easiest way I think to think about it is just that, just like clinically autism can exist on a spectrum, so really is the interplay between genetics and environment, Alex. And so, what most experts at this point say is that it's really a combination of enhanced screening as well as expanding diagnostic criteria. Just a couple of years ago, a study highlighted over 100 potential genes that could contribute to risk. In terms of environment, the different kinds of things that researchers are looking at as contributions include pesticides, phthalates, air pollution, maternal age, other in utero exposures, medications, for example, that all contribute to the risk. So it's very heterogeneous. There's not one explanation. And scientists have been trying for decades, Alex, to really elucidate the exact cause of autism, and we're just not there yet.
And it's going to take a lot more focus and research to find out the answers, but there is growing concern now around the new budget cuts to the Health and Human Services Department, on top of the layoffs we've already seen. The Trump administration is eyeing about $40 billion in cuts to HHS next year. That's according to a memo obtained by the New York Times. This document also proposes eliminating dozens of programs focused on public health challenges, like autism, also teen pregnancy, to name a few. What are the implications of cuts this massive?
So, Alex, they're far-reaching, and I think some of these will be felt acutely, and many of them may be felt for generations and decades to come. That $40 billion represents about a third of the current budget, and they're achieving that by consolidating some programs and eliminating completely certain other ones. And no agency is untouched. There are massive, massive changes happening at the NIH, at the CDC, different programs for disease surveillance, outbreak preparedness. At the FDA, there are changes. You highlighted a few in terms of research into autism, teen pregnancy. A lot of DEI initiatives are going to be erased. And some that really kind of hit home for any of us is, a program like Head Start, which is a tool for education and nutritional, help to students in need. All of those, or many of those, either the funding is being slashed or eliminated completely.
Yeah, there's also concern about funding being slashed relative to the measles outbreak that we have across the United States in this country. But Dr. Natalie Azar, my friend, thank you so much for that.